A pandemic milestone, 1 million cases of COVID-19 reported in Florida.
And we're now the third state in the country to reach that number. Florida joins California and Texas, but we report more cases based on population than either of them. This graph shows where we stand in comparison. Florida is the yellow line, Texas in red, California in blue. And as you can see, Florida ranks number 23rd in the nation per 100,000 people. Wink News Health and Medical reporter Veronica Marshall in the studio now. What does this 1 million number mean for our hospitals?
It means more strain on hospital resources. Lee Health announced it's at 90% of its staffed bed capacity, with 11% of those COVID patients. And it's not the only one with numbers like that.
In Charlotte County, cases are rising.
Our numbers are up significantly. We've had a few days where we've had over 70 cases in one day.
Dr. Joseph Pepe with the Department of Health says this wave is even harder to fight.
And what we're seeing is just a lot more widespread in the community. So it's been a little more challenging to fight this one than it was, let's say, back in March and April.
The battle is spilling out all across the state as cases climb over the 1 million mark.
So the United States has the most COVID cases in the world, around 13 million. If you were to make Florida its own country, it would be around number 15.
Dr. Nicole Iovine, an infectious disease specialist with the University of Florida, says the caseload will strain hospitals and impact patients, whether they have COVID or not.
Being stuck in an emergency room for 12 hours or 13, 14 or longer because there's no bed for you because we're full of COVID patients, that's not going to be the best way for you to get the best health care.
A grim reality already playing out in Charlotte County.
We're seeing some challenges where ambulances are bringing patients and there may be some delay time before they can transition patient into the hospital. Not that they're not receiving care, it's just bed availability and staffing and things like that are a major challenge.
While our case counts are going up, our death rates remain stable. That's because as we've learned more about the virus, healthcare leaders have learned more about how to treat it. However, deaths lag behind cases, so it's something to keep an eye on as our cases go up and our hospital capacities go down. Lois?